Hi, everyone, and welcome to the second video of CICS's discussion series. I'm Zach Day, one of the co-hosts, and I'm excited to bring you another video in which CICS will highlight the work and the writings that our great partners and providers have been doing. I'm here today with my other co-host, Audrey, and I'll pass it off to her to introduce our special guest for today, Dr. Camasto.
Great, thanks, Zach. Again, I'm Audrey Lovu, if you didn't get to watch the first video. And I'm excited to be able to introduce our guest for today. I'm going to kick it off to her to be able to give a little bit of background about herself and to get us really started in the conversation today. So I'll pass it over to you, Dr. Camasto.
Hi, thank you so much for having me and including me in this video series. I appreciate it. Well, just to tell you a little bit about myself, I'm originally from New York State. I went to undergrad at Cornell University and medical school at State University of New York at Buffalo, and then completed my 3-year pediatric residency at Rainbow Babies and Children's Hospital in Cleveland, Ohio. And then in 2000, I moved here to the Lehigh Valley, and I've been practicing primary care general pediatrics ever since. And about 5 years ago, I discovered the field of functional medicine when I was trying to figure out some of my own health challenges. And I fell in love with it pretty quickly. I realized that practicing functional medicine was my true calling. So after getting some more training and doing a lot of legwork, I actually opened up my own pediatric functional medicine practice called Pediatric Whole Health. It's a consultative practice, so not primary care, but it's going to be focusing on health restoration for kids with chronic illnesses like ADHD, anxiety, depression, fatigue, autism, gut stuff. Over the last 21 years, I've seen the number of children taking medicine for some kind of a chronic illness just skyrocket. And now that I know about functional medicine, I'm not the kind of person to keep things quiet. So I want to share this with the world and tell parents that there is another option for their kids, that what's going wrong in their body has an explanation, and with a little bit of investment and effort, they might not need to be on a chronic medicine for the rest of their lives. So I was very excited when you asked me to write the blog, because it just seemed like a great opportunity to explain things as to what functional medicine is. And when I titled it "The Future of Healthcare is Here, a Functional Medicine Approach to ADHD, Anxiety, and Depression," because I wanted to convey the idea that we don't have to wait for some other scientific discovery to happen in the future in order to start turning around this epidemic of mental health problems we're seeing in our young people. And the knowledge is actually here, and there are functional medicine doctors already utilizing it and practicing that way. So I'm just trying to get the word out. So to describe a little bit more about what functional medicine is, I like to compare it a little bit to taking your car to a mechanic. This is a simplistic comparison, but just bear with me. So when you take your car to a mechanic, you describe the symptoms and they check it out, they diagnose it, and then they fix it. And that's sort of the same thing with functional medicine, although, there's a lot of steps in between. So what it does, there's a comprehensive understanding of, first, what does the body need in order to stay in balance and work optimally? Well, we need nutritious food, we need adequate sleep, we need clean water, we need vitamins, we need minerals, we need positive relationships, we need rest and relaxation. And those are things that I'd say most Americans aren't getting enough of. And then the other end of the functional medicine paradigm is understanding the dynamics of what goes wrong in the body and what can have a negative impact on the functioning, like toxins in our environment, stress, trauma, infections, allergies or sensitivities to foods that create inflammation in our gut. So once we've done an investigation to what isn't, what don't they have enough of the good stuff of, we try to replace that. And then we look at what bad stuff they have too much of. So we try to work on eliminating that. And then the body can actually do its work to heal, because the body actually has an incredible ability to heal on its own when it's given the right tools. It's amazing. And you can kind of tell I get very passionate when I talk about it, because it's just partly why I went into medicine. It's kind of like, a miracle the way our body is supposed to work. So, and then another important aspect of functional medicine, I think, is a relationship between the practitioner and the patient, and individualizing a treatment plan to the unique person, because the reason why a person got to a state of illness is different, and the way they have to get back to health is, the journey is going to look different for each person. So the practitioner really comes alongside of the patient and almost acts like as a little bit of a coach as well as a medical practitioner. So hopefully that sort of summarizes functional medicine, but I want to give you a little bit of an example, like as it applies to, say, ADHD. So ADHD, to me, is a symptom, not a diagnosis. And the traditional model looks at ADHD as being a deficiency in dopamine, which is the neurotransmitter that's responsible for focus and being able to regulate. But when you pare it back and ask the question, well, why do they have a problem with not enough dopamine? Well, in order to make dopamine, your body needs enough tyrosine, which is an amino acid. So if you've got really poor nutrition and not enough protein, that could be a factor. You need zinc and iron and vitamin B6 and magnesium for that whole pathway. So a kid exhibiting classic ADHD symptoms may just have a deficiency in those nutrients. Or there could be some kind of food intolerance that's causing their stress hormones to kick in because of the inflammation related to the food intolerance. And that's going to, when you have too much stress hormone, that's going to affect your ability to sit still. And then you could have mitochondrial weakness and insufficient omega-3 fatty acids. So there are so many layers to look at in a child who has ADHD symptoms. And I'm not saying that Ritalin and Adderall and those stimulant medicines don't work, but they're just looking at one part of the mechanism. They're just looking at increasing the amount of dopamine in the synapses of the neurons, and they won't detect if there's a nutritional factor involved. So I love functional medicine. I think it also is my calling, because I'm a very good listener, and in functional medicine, the practitioners really have to listen to the patients and dive deep into their history to put the pieces together of the patient's life and see, well, what happened to make things go wrong? And I like calling it like being a medical detective. You're trying to understand what symptoms they're having and match it up with what system of the body isn't working right. And then we try to fix things, not so much by giving a medication or a supplement to suppress the symptoms, but peeling back the layer of the onion. I like, it's one way of thinking of it is, okay, you don't have enough zinc, let's replace that. Okay, you're really stressed out all the time, you're not sleeping well. So each layer is an opportunity to bring the person's life back in balance, and then healing the dysfunction. And oftentimes you need to heal multiple layers of dysfunction before the symptoms are completely resolved. So that's my summary of functional medicine, as I try to make it as simple as possible because it is very involved.
All right, awesome. Well, thank you, Dr. Camasto, for that whole overview of functional medicine and how it's implemented and its benefits. I just want to mention before we get into the Q&A that Dr. Camasto's piece, The Future of Healthcare is Here, a Functional Medicine Approach for ADHD, Anxiety, and Depression, is on our website, and the link to it will be included in the description of this video. I would highly recommend checking it out if you're interested in learning more about this approach to medicine, how it's implemented, and its benefits. So now going into the Q&A, Dr. Camasto, the first thing I was wondering is, in your piece, you mentioned that functional medicine has been around for over 30 years at this point, but it seems like it's really only started to gain the popularity that it should. And so with that in mind, why do you think functional medicine had taken a while to gain this traction? And what factors do you think need to occur to continue to push the popularity of this approach forward?
So that's a $1 million question. And I think that the full answer to that is multifactorial and complex, but I can offer some observations. So I think, first of all, 30 years ago, when the field of functional medicine was born, there wasn't really this great burden of chronic disease in people. And, back in the 90s, I think most people had reasonably good health, and the medical system was able to adequately care for the needs, the healthcare needs of the population. So there wasn't really a great need for another alternate healthcare paradigm. But looking back at my 24 years in pediatrics, it's been like maybe the last 15 years that we've been seeing a skyrocketing of childhood chronic health conditions, and probably adult chronic conditions as well. I think this latest statistic is that 60% of adults have some kind of chronic health condition. Conventional medicine has evolved to really excel at things like cancer treatment and joint replacements and stroke care, life-saving care, acute care, transplants, but it's kind of lagged in its ability to reverse chronic disease. And they say that there's often about a 15-year lag between new science and it getting implemented. But the reality is that functional medicine was created with the goal in mind to treat chronic disease, and that's where it really shines. Now, I don't want to sound like I'm insulting the regular medical community, because there are a lot of very talented, hardworking, caring people who they're fully invested in getting their patients well. But there are a couple of things with just the medical paradigm that we have that I think interferes with that. And one is that there's still a mindset that when you go to the doctor is going to fix your problem, and that there's a pill that will fix your ill. And all you have to do is take a medicine and you'll get better. But I think we're lacking the understanding that in order to really get well, the patient has to take responsibility for their own health, and they have the power to change their health trajectory by the everyday lifestyle choices that they're making. So that's one. And then the other factor is that time is against us as physicians when we're in the office, because we can't cure someone's chronic illness with 15-minute visits. There's a huge amount of education that needs to happen for a patient to understand why they got to where they are, what's going wrong in their body, and what they need to do to fix it. And so I think education and patient empowerment has to become incorporated into every patient encounter, which isn't happening now in 15-minute visits. I am not sure if people listening are familiar with health coaches. Health coaches, I think, have recently, maybe in the last 10 years, become very popular. There are programs popping up all across the country, and health coaches are people who basically come alongside of patients to basically coach them and motivate them, keep them accountable to making the changes they need to make to get better. So I think that we also need to get health coaches just more involved in primary care practices. So that's one thing that I think has to happen. I think another thing is that patients need to become more disgruntled with just having mediocre health, and having to take multiple daily chronic medicines, which often have undesirable side effects. And then patients need to understand that they have an option of having better health, good health, even optimal health. Somewhere along the line, I think we became complacent as a society with this idea that when you age, you are by definition going to have some kind of illness. And functional medicine tells us that that doesn't necessarily have to be true. I also think if patients push practitioners to approach things in a more holistic way, then we have to learn different avenues of practicing medicine. So instead of just prescribing a medicine for a condition, being able to think outside the box, or having patients go Google something online and say, here, I heard about this, could we use this instead of this medicine? So I think having buy-in from patients is going to be a key player in pushing the physicians to learn more about this. As practitioners, I'm trying to learn more and to talk more about this and spread the word to other practitioners so they might become curious and hear about these success stories of people reversing their chronic disease. And maybe because honestly, 10 years ago, I didn't know about functional medicine. So you don't know what you don't know. So the more we're talking about it as a community, then hopefully other practitioners will become curious and pursue a little bit more training. I do want to just point out that, we don't need every doctor to go back to school and become functional medicine practitioners. There's actually a lot of very simple things that can be incorporated into day-to-day interactions with patients that are functional medicine principles that could have a big impact. Just the concept of eating hygiene, because a lot of people have heartburn, and that can be related to chewing too quickly, or eating in a stressed state, not having enough magnesium in your diet, or a food sensitivity. So that's something that's relatively easy to discuss with a patient without having to go back to school for functional medicine. So anyhow, I think those things can all be very instrumental in getting this little grassroots movement going and gaining more speed.
Awesome, thank you. And I appreciate what you said before about the uptick in the chronic illness, because it seems like every day the medical needs of society are always changing, and functional medicine really seems to be filling that need that's presented itself over these last few years in a way that's not as intricate or not as difficult as many people may think. So
absolutely.
I know Audrey has another question, so.
I do. Thanks, Zach. So as you mentioned in your blog, there are many differences between the functional medicine approach implemented by you in your practice and the conventional methods to healthcare that's implemented in our current medical system. Could you walk us through some of those major factors that set functional medicine apart and how this approach interacts with other methods of care?
Sure. Well, I think I've mentioned some of the differences already, but just to outline them more clearly. So functional medicine looks at a symptom reflecting some dysfunction going on in the body and tries to find the dysfunction and fix it. Whereas oftentimes in conventional medicine, they are giving a medicine to suppress a symptom. Like heartburn, like I was just talking about, is a really good example. When we have heartburn, most of the time, it's not because we have too much stomach acid. There are cases where people overproduce stomach acid, but as we age, we know that actually we decrease our amount of stomach acid that we produce. So the Zantac or Prilosec that we take is going to decrease the acid. It's going to help the symptom, but we need enough stomach acid to digest our food properly. So, and if you think about it, it may not be that it's too much stomach acid. It may be that it's just in the wrong place. And so fixing that requires a different sort of approach. So that's one. And then the one thing that I think is also very different is that functional medicine is aiming to restore health for a person as opposed to just manage their chronic illness for the rest of their lives with the medication. Functional medicine also looks at the impact of environmental factors on a person and their health, where, like, say, for instance, toxicity, which I don't think, for the most part, conventional medicine dives deep into that unless it's overt toxicity. So, like, for instance, a lot of people have mercury fillings in their teeth, and I actually had 9 mercury fillings from childhood. And mercury is continually off-gassing from those fillings because they're about 50% mercury, and that gets built up in your body. And if a person doesn't detoxify that very well, that's going to stick around and start creating problems. And that was definitely a big factor in my fatigue. So I don't think that would have been picked up by my regular PCP. So definitely environmental exposures are definitely focused on with functional medicine. And then I think just partnering and with the patient and seeing what the patient's values are and what their goals are. It's more of a partnership than interaction where the patient comes into you as the physician and you tell them what's wrong with them and tell them you have to take this, and then they go off and do it. It's more of a give and take in the functional medicine model, which I think is really a key factor for us to consider as healthcare evolves. I think people do better when they understand the why behind things and why you're asking them to do X, Y, and Z, and they have more buy-in. So the partnering approach is critical. And so I think to really get past our chronic health epidemic, a combination of the two is going to be what helps us the best, because we need both. We need both conventional medicine and functional medicine. But somehow we need to find a happy medium. And well, I know that there are centers that are up and coming with both side by side. The Cleveland Clinic has a program of functional medicine, and then Thomas Jefferson as well. So there are these major medical centers that are embracing functional medicine and bringing it to the public, which I think is great, especially with the times that we live in. It's so necessary. And I think the other part of functional medicine is that it needs to become affordable, because there are a lot of practitioners that don't accept insurance. And I think the insurance companies need to become more aware of what this is and get on board with providing coverage for it, so people with insurance have access. It's coming. It's slow, but it's coming.
Awesome. Thank you. And I really like the way you talk about it being more of a partnership. And I think that's so important when I just think about, my own self and my own histories. And it's easy just, if someone to give you, a pill to cover the symptoms versus looking at the whole holistic picture. And I think that's what's really intriguing about the functional medicine approach. So thank you. I appreciate that.
You're welcome.
All right, and yeah, so before we wrap up this video in the series, I wanted to give you a chance, Angela, to talk about your practice, Pediatric Whole Health, as it relates to functional medicine. So could you tell us a little bit more about the practice as a whole, and then kind of give us an idea of how your practice integrates functional medicine into its work?
Yeah, definitely. So I structured my new practice around wanting to give personal care and individualized attention to patients. And so if they come to my practice, they're working just with me. It's just me. No receptionist, no nurse, it's just me. And my goal is to really find out as much about the individual person as possible, to see all the potential factors that are contributing to their health concerns. So functional medicine is pretty much there on some level throughout the whole process. When I'm taking my history intake, I'm asking detailed questions about how are they born, vaginally or C-section, because that impacts your gut microbiome, which is a huge factor in your overall health. What stressors have they had? How many times have they had antibiotics? Have they taken acid reducing medicines? And then when I look at the physical exam, I'm looking at the underlying meaning of a finding. Like, for instance, some people have that really bumpy skin on their arms called keratosis pilaris, and that could be gluten sensitivity. It could be a vitamin A deficiency. It could be not enough healthy fatty acids in the diet. So I'm looking at the physical exam from a different perspective. And then when we look at lab work, we're looking not so much as, okay, does this fall out of range, high or low, but we're looking at where does it fall in the reference range, and is it really optimal? Because there are a lot of times that something falls kind of on the lower end, but it's still normal, but really it may not be optimal for that person. So we're interpreting labs a little differently. And I also spend a lot of time showing diagrams and explaining physiologic processes, so that people will understand the why behind what I'm asking them to do. And then again, the partnership, when I'm creating a treatment plan, I want feedback on, is this doable for them? And I just told a patient the other day, I said, okay, your job is, if I'm asking you to do something and you're thinking in your head, there's no way I'm doing that, tell me, because we can try something different. And I'm not helping you if I'm asking you to do things that are outside your comfort zone, or just it's not going to be possible with your schedule and what other things you've got going on. So I really hope to educate, to give them actionable baby steps of changes that they can make. Hopefully not overwhelm them, but give them steps so that they can implement them enough that they can reach their health goals. It's a process, and Rome wasn't built in a day. So
Exactly. Well, I like what you mentioned about reducing the question of why from the patients. I think that's really important, especially now when so many parts of medicine can seem complicated and confusing. Giving them treatment that helps, but also is very digestible and understandable is a huge thing to provide patients these days. Well, that concludes our discussion for today. Dr. Camasto, I thank you, Audrey thanks you, and
thank you.
CICS thanks you for all the great work that you do, and also just for joining us today and talking to us and teaching us more about functional medicine. And also thank you everyone else for watching this second video in the series, and we look forward to getting the third episode out soon. Thank you again, Audrey. Thank you again, Dr. Camasto, and I'll talk to you both soon.
All right, sounds good. Thank you.
Bye, thank you.
Bye.